Ladies and gentlemen, please rise for the procession of the white coat recipients from the College of Chiropractic at Northwestern Health Sciences University. Please remain standing for the national anthem. Please be seated. On behalf of the T6 class and all of us associated with Northwestern Health Sciences University, I extend our warmest welcomes to our campus, to everyone attending this College of Chiropractic White Coat ceremony. I especially welcome our most honored guests, the families and friends of the recipients whose support and presence here today means so much for them. So, before we begin, I would like to introduce some of our Northwestern administrators and faculty. And I'll ask them to maybe just give a wave. So first on my list is Mike Tennyson. He is the Vice President of our clinics. Did you wave, Mike? Good, yeah, thank you. Just to clarify, this is not supposed to be a formal event, but one of celebration, so bear with me. Next on my list is Dr. Jody Dorpinghouse. She's the assistant professor and today's keynote speaker. There we go. It's getting funner. To her left, right? Okay. Dr. Christy Wiebel-Manham is the assistant professor, clinician, and presenter of recipients. One of my least favorite faculty member, Dr. Chris Petrie. And running a close second to least favorite, Dr. Brad Feiner. Those two gentlemen, and I use the term gentlemen loosely, will be assisting the recipients with their coats. And I am the Dean of the Chiropractic Program. My name is Dr. Trevor Foshang. So folks, welcome to our ceremony tonight. So good evening again, and everybody, Thank you for joining us on this kind of not such a great evening. Thank you for making the trip out. I actually have to admit that this is my favorite event on our campus, even more so than graduation. There is a different excitement amongst the students as they receive their white coats. Our students aren't quite ready to graduate, in fact. So for many reasons, this is a celebration of a new beginning. They have moved past some of their foundational work and are excited to enter the next phase of training in the clinical setting. And as always, it is exciting to see family and friends celebrate alongside with them. So again, thank you for being here. So they have white coats on their laps, and you're going to see them coated today. So let's talk a little bit about the white coat. So the white coat originally was developed to be worn in scientific laboratories and was adopted as a standard of dress by doctors, clinicians in the late 19th century. So as physicians were wanting to incorporate scientific principles developed in the laboratories, they wanted to bring those principles into the clinical setting. Make sense? So the donning of the white coat is now a century-old tradition and represents a symbol of a tremendous amount of responsibility of the doctor, which of course was to acquire a bunch of knowledge and then be able to apply that knowledge for the betterment of their patients. However, there are some practical reasons for wearing the white coat. So ease of recognition that you are a healthcare provider, and as potentially a need to carry items, it can be used as a repository for such items. So in turns, your white coats will be filled with tools. You'll wear a stethoscope, you may have a reflex hammer in a pocket, maybe a tuning fork. Nobody knows what that is. Tools of your trade, so to speak. So as a result, these white coats will become heavy. So today, as Dr. Feiner, second least favorite, and Dr. Petrie, as they place this white coat on your shoulders, it is a time for you to take note of its feel and of its weight. So recognize that when you receive the white coat and when you put it on from this day forward, that it is a responsibility that you're wearing, figuratively wearing a responsibility to your patients, using that information that you've gleaned over the last several years to treat your patients for the betterment of their health. So that would not have been possible, however, without a tremendous amount of help from faculty. So interns, would you please join me in thanking your faculty that have joined us today? And maybe faculty, you could stand and be recognized by all of us in the audience. Please. Please. So please join me in thanking them. So as you can see, we have many exceptional faculty members that have joined us to celebrate today. One of those exceptional faculty members is Dr. Jody Dorpinghouse, who will provide us with a keynote address. So before I give the podium over to Jody, I'm going to tell you a little bit about her. So Jody graduated from Northwestern Health Sciences University in 2008 with a doctorate in chiropractic and a bachelor's degree in human biology. After 2 years abroad participating in practice in Scotland. Is that correct, Jody? Scotland. She returned to Minnesota with the goal of opening her own practice, and in 2012 she did so. Evolution Chiropractic was formed, providing high-quality care and personalized care to each and every client and educating our community. So Dr. Dorpinghouse joined us in 2016, and we are happy that she has. In her free time, Dr. Dorpinghouse is very active in the American Chiropractic Association's Sports Council and the Minnesota Chiropractic Association's Council as the chair of the Sports Council. Is that correct, Jody? I got that right. Folks, please join me in welcoming Dr. Dorpinghouse to the podium.
Oh, you guys let me have a microphone. You asked for this. You asked for this. Okay. Well, hello, everybody. For those of you that don't know me, I'm Dr. Dorpinghouse. I am one of the methods professors here at Northwestern Health Sciences University. I'd like to thank you all, first of all, for coming out, especially on this night, to support your loved ones. Because without you guys, honestly, it would be much more difficult to go through this rigorous program. So your love and support, quarters, food, leftovers, all of those things, very, very helpful to our students in making their life easier. Well, this class will always hold a very special place in my heart. I don't know if any of you know this, but this is the first class I ever taught. So they had the privilege of the first semester ever of me teaching. Throughout the semester, this class did their best to make me into a professor. They tried their best to read my PowerPoints, usually as I was presenting them, and proofread them. You know who you are. Yeah. They would catch my minor changes in the few adjustments I had to teach them, just one or two adjustments here and there. Usually, just in general, they tried to keep me very much on my toes. Usually with a well-timed question, in-depth question that I maybe didn't have an eloquent and or succinct answer to. Again, you know who you are. Corey, where are you? See you. Okay. Good. All right. Since then, though, I have really had the opportunity and the pleasure to watch you guys grow and change into the interns sitting in front of me today. And I will say, without sounding really condescending, I am really, really proud of you guys. This white coat ceremony is a huge rite of passage. You guys are entering into your final stages of your education. And now is the time for you guys to develop the doctor portion of your soon-to-be practice. So now is the time for you guys to polish up your skills that I keep saying you're going to have them, just keep practicing, you'll have those. And then also really to use the knowledge we jammed in there somewhere. There's lots of it. You just put it right in there, then Mr. Miyagi do. So, as you've heard me say over and over again many times, practice like you play in these next few months. So to prepare for tonight, I had asked a bunch of senior faculty and a bunch of students what I should say. And the two pieces of advice were, you better be funny, Andrea. Yeah, you better be funny and keep it short. So I will do my best. So I sat down and I kind of thought to myself, what was my first day in clinic like as a real doctor? Or even as an intern for that matter, because that was probably even more laughable. And so many things came to my head. I was like, oh, I got like so much advice I want to give them, just poignant advice. And then I thought we don't have time for that. So what I came with is 3 main pieces of advice for my soon-to-be colleagues. Number 1, pick your clinic clothes carefully. All right, don't deny it. Some people were asking me what to wear tonight. Okay, so getting dressed for clinic at first is very much like getting dressed for the first day of school. You're like, oh, I'm so excited. Okay, what am I gonna wear? I gotta be like stylish, but not too stuffy, and I wanna be professional, but not overdo it. I'm gonna do this. Let me tell you what not to wear. Definitely not 6-inch heels with slippery bottoms. Not that that happened to me at all. And gentlemen, clinic check those shoes. Anything slippery on the bottom, no good. No good. The reason I say that, because if you don't know already, you will, that side posture is not literal. So that side posture body drop, not literal. I may not have dropped anybody off the table in my 10 years, but I can tell you I've fallen on them. Okay? Also, guys, quick side note, make sure that your trousers and shirts are fitted properly, please, and or stretchy. Again, if you don't know why, you will. Keep a backup outfit at your clinic or in your car. This may be through fault of your own or not. So just to learn from our mistakes. just in case you decide to hulk out of your shirt while doing an anterior, or that very amazing stretch that you showed your patient had too much range of motion for your pants. Okay? All of us up here have at least one story of ourselves or interns that this has happened to. So again, learn from our mistakes. Okay, that was the more embarrassing one. Number 2, managing your patients is a lot like having your own kids. For those of you that have children, you know exactly what I mean. For those of you that don't, that's okay too. There's 2 reasons I say that. It's different when they're yours. That's the piece you need to know. First, because the kids will say the absolute strangest and most revealing things to you when you're least expecting it. First thing in the morning, last patient of the day, that's when it's happening. So practice that poker face, okay? Because when this happens, you need to be professional, and it will happen. So, be professional. Smile and nod. That's usually a good go-to. This will serve you as well in practice as it does in life. And second, watching a well-polished doctor is very much like watching a well-behaved child in public. Well, managing your patients and communicating with your patients looks very easy when somebody else is doing it. It's not so easy when it's you, okay? So just like you see that well-behaved child in the grocery store and you're like, oh my God, look how cute that kid is, honey, let's have babies, it's gonna be easy. Yeah. So, because they've had years of practice, this is very, very deceiving. It doesn't just happen overnight that the absolute perfect phrase at the right time comes to you to say to your patient. Okay, and I know you guys can take that to heart. When you're taking a history, or when you're standing in there with your patient, and you're like, they ask you that question, and you're like, yeah. It's gonna make you real, real uncomfortable, but get comfortable with it now. Better now than later. Okay? So take every opportunity you have right now to learn something new and then translate it into English for your patients. And you know what I mean. Don't go doctor talk. Okay. Point number 3, build your village. Okay, so just real quick, look left and right. So look to your left, look to your right. Okay, good, it becomes interactive, then you don't have to stare at me. These guys and girls are gonna be your colleagues. But a very strange thing happens when you go into practice. Life kind of slowly creeps in, and you slowly lose contact with people who have become your brothers and sisters over many, many years of making it through this program together. Or even worse, they may become competition to you. So try your best to have an open mind, because with our profession especially, there's strength in numbers, and you don't want to lose those numbers. You'll have questions and stories, hopefully HIPAA-compliant stories, please. Cases that are going to stump you. You know, who do you ask? And if you lose contact with your friends and your faculty, the only stupid question is an unasked question. So if there's someone around you who can give you that answer, definitely reach out to them. Make sure I got all the points on this one. So, last piece of advice would be surround yourself with people smarter than you. If not, a community of like-minded chiropractors that is really going to help you throughout the years. This is where your chiropractic associations come in handy. There's my plug. If chiropractic associations are not for you, Dr. Fargo, are you in this room? Okay, his phone number. I'm just kidding. I'm not going to give out your phone number. Although Kaylee did offer it, so you should feel really safe with that. Yeah. So just remember, you guys have all these months of kind of hard work in front of you. So you guys thought the easy work was or the hard work was all the studying and all the 82 tests in 2 weeks. The hard part is becoming the doctor that can not only feel and fix what's going on, but also translate that message to your patient in a way that they can relate to it. So don't forget, in all of this, my nice lighthearted message, to have fun, because I know you guys take this very seriously. You always have. Have fun, okay? Because there are going to be nights that are going to keep you up. You're going to be like, oh, did I get that diagnosis right? Something on that x-ray I'm missing. It's bugging me. Don't let that stuff get to you, you guys. Leave your work at your work. You are the doctor. You're the doctor, all of you, not us. Okay? So you've prepared for this. We've prepared you for this, believe it or not, right? So just remember that if you love your job, you'll never work a day in your life. All right? And I would like to thank you all for having me, because I think I've gone over my 5 minutes. So thank you all for having me, and have a wonderful night, and celebrate this night. Not too hard, but celebrate it. Celebrate it responsibly. And thank you for asking me to be here.
Thank you, Dr. Dorpinghouse. So it's my privilege now to present Dr. Christy Wiebel-Manning, who will introduce our white coat recipients. Christy, would you join me at the podium?
Okay. On behalf of the faculty of the College of Chiropractic at Northwestern Health Sciences University, it is my pleasure and distinct honor to present the recipients for white coats. I ask our new interns to come forward as I call your name. Dr. Chris Petrie and Dr. Brad Feiner will assist with the presentation of white coats for the recipients. I invite any family members or friends to come forward and take photos as your interns cross the stage. Okay, so we'll begin with Stephen Thompson. Christy Arneson. Daniel Bilderback. Travis Bird. Jacob Block. David Carter. Joyce Cundiff. Monica Kuricic. Philip DeGraff. Tyler DePaulis. Cooper Dykstra. Brandon Deerdahl. Dakota Freiborg. Oh, is she not here? Okay, well, we'll go on. Christine Grenier. Andrea Groff. Dylan Hendricks. Claire Jessen. Isaac G. Johnson. Kaylee Kern. And she is being coated by her father, Dr. Tim Fargo. Kathleen Lippert. Jeffrey McDonald. Sabra Minen. Crystal McCauley. Kayla Middendorf. Kelsey Morrow. Zachary Nelson. Miranda Neibauer. Kylie Norrell. Jace Nybo. Tyler Penzis. Alexander Provost. Scott Redman. Jason Reed. Janelle Remington. Janelle Riedel. Miss President Samantha Scarsala. Melanie Schwiedert. And she is being coded tonight by her father, Dr. James Schwiedert. Brandy Searson. Corey Sayre. Tanner Swiston. Lika Zhang. On behalf of the College of Chiropractic at Northwestern Health Sciences University, please join me in congratulating our newest White Coat recipients.
Stephen, will you join me? Stephen is a member of the T6 class and is the current Vice President of the Student Senate for Chiropractic. He will be administering the chiropractic oath. Stephen, please join me.
All right, so for the reading of the chiropractic oath, can I have everybody please stand? Not everybody, just them. All right, so it's up here if anybody wants to read along with us, but we shall begin. It starts, I do hereby affirm before God and these assembled witnesses that I will keep this oath and stipulation to hold in esteem and respect those who taught me this chiropractic healing art, to follow the methods of treatment which, according to my abilities and judgment, I consider for the benefit of my patients, to abstain from whatever is harmful or unethical, to stand ready at all times to serve humanity without distinction of race, creed, or color. With purity, I will pass my life and practice my art. I will at all times consider the patients under my care as of supreme importance. I will not spare myself in rendering them the help which I have been taught by my alma mater. I will keep in confidence all things revealed to me as a physician. While I may keep this oath unviolated, it may be granted to me to enjoy life and the practice of the chiropractic healing art, respected by all people at all times.
You may be seated. So I absolutely love this particular ceremony, so I would love for the audience to join me again in congratulating our newest White Coat recipients. So audience, please rise for me and remain standing for the march of the processional back out of our room. And once our students have left the auditorium, please join us for reception in the cafe just right around the corner. Thank you all again for joining us this evening, and have a safe trip home.